Thanks for staying with us. Today we'll be celebrating one of Nigeria's finest neurosurgeons, Dr. Omotayo. Last week, it was trending all over social media as the successful procedure he performed on the popular social media medical influencer and content creator, Dr. Chinonso Egemba, popularly known as Aproko Doctor. There was an outpouring of encomium showered on him, his work and personality. He'll be speaking to us about tumor, and most especially brain tumor, the possible prevention, management, and the procedure to eliminate it. Welcome to the show, sir.
Thank you very much.
How was the newfound popularity? Everybody talking about you, your celebrity status.
Well, I think it's good. It has brought a lot of attention to neurosurgery in the country. And I hope that many people would seek intervention early so that they can all be better off from the problem. All right.
So to join the conversation, call us on 081-270-53687, or you can call us on 091-390-76948. Let's bring you back to the real topic.
Okay.
Brain tumor. You know, Aproko Doctor's story shocked everybody because we felt like, hey, you're the one teaching us about how to be healthy, and we're looking to you like you're the healthiest person, and suddenly you have a brain tumor. So what are the things that trigger brain tumor, and what can we? Yeah, let's just start with that.
So just to talk about the overview of brain tumors, there are two different categories of brain tumor. There is a primary brain tumor, and there is a metastatic brain tumor. Primary brain tumor means the tumor originates from the brain itself. Okay. Metastatic brain tumor means the tumor is coming either from breast, lung, and other parts of the body. So, brain tumor is something that nobody should have. And when it does happen, the earlier it is picked, the better. Because when it is seen early, then it can be treated with minimal complications. To answer the question, what causes brain tumor? For the primary brain tumor, nobody knows. It's not what somebody is doing or is not doing, what he ate or didn't eat. It has nothing to do with lifestyle generally, especially the primary one. It just starts sporadically, meaning anybody could have it, unfortunately.
I don't even like that.
With the metastatic one, that one, if you get, maybe if the person has cancer in the breast, then it can transfer to the brain. That's the metastatic one.
Exactly. So for people that had breast cancer or spine cancer or prostate cancer in men, or sometimes cancer of the womb in women, it can transfer to the brain, unfortunately, even though in some instances they've had all cure for the primary tumor. So it can happen.
Happened to my friend. Very, very traumatic.
You know how with the breast tumor, they'll say check yourself. But how do you check a brain tumor before you go by yourself?
That is the problem with the breast. I mean, with the brain. It's difficult to pick. For most people with brain tumor, what they would have first will probably be headache. And if you put it in perspective, many people in Nigeria would have headache at one time or the other. Driving from mainland to highland could give headache. But headache that persists and wouldn't go away needs to be checked. And from headache, it could progress to other problems like visual problems, like being forgetful, and unfortunately can lead to seizure. So we've talked generally to people. If an adult would have a seizure for the first time as an adult, it's brain tumor until proven otherwise, 99.9%.
So, but if by the time you have the seizure, that already means, doesn't that mean that it has advanced to?
Not particularly. So when we talk about the presentations of brain tumor generally, it depends on the site.
Okay.
There are some parts of the brain that a 1 centimeter tumor would give seizures. It depends on the size. There are some parts of the brain that the tumor has to be at least about 5 to 6 centimeters, which is probably the size of an egg, before the patient would know. So basically, it's the site, the size, and what is the structure of the brain that is very near to the tumor. So for instance, if there is a tumor very close to the optic nerve,
Okay.
it will present early with visual symptoms.
Okay.
If there is a tumor that is very close to the motor strips of the brain, so what that means is different parts of the brain have different functions. So if it's on the part of the brain that subserves motor, the patient will present with seizure early. If it's in the salient part of the brain, it can grow very large, taking probably half of the brain before the patient may even present.
So because laymen are watching, and I'm wondering, the brain is usually protected by the skull. If you now have a small something on the, maybe like a swelling between the skull and the skin covering it, that's out. You just maybe you should feel a dark, thick something around your head. Could that possibly be a tumor, or does it have to be
Inside
the skull?
So that brings us to another classification of the site. There are some tumors that are right inside the brain. There are some that are outside the brain tissue but still in the head. So for those type of tumors that are not particularly within the brain substance but in the head, there is a possibility that there could be pain on the head and the person can put finger on it and probably feel that there's something going on there. And that is quite common with metastatic brain tumors because it would involve the bone early, this particular type. And by inference, it could get to the skin, there could be a swelling, then pain, and so on and so forth.
Yeah, I wanted to ask, is there, if you detect a brain tumor early, do you always have to go for surgery, or you can treat it without having surgery?
Can it resolve itself?
So the general answer would be yes. But the practical answer would be that there are some that are so small, still in the brain, and we look at the progression and we could say that it's unlikely that tumor would affect the person in this lifetime because they grow very slowly. But any tumor that is found to have been giving some symptoms will probably need to be excised. And to answer the question, the earlier the better. It's unlikely anybody would have brain tumor and the doctor would say, no, don't do anything. But what we see is people with brain tumor will be so careful and afraid of surgery, and they will hold back making a decision.
Worse.
And in another 1 year, you do the scan again, you realize that the tumor had grown bigger. The problem now is that the bigger it becomes, the more complex the surgery would be.
Yeah.
So what I could remove in 1 hour a year ago could probably need about 2 or 3 hours in another 1 year. So the earlier it is done, the better, number one. The earlier it is done, the safer. Because if it is small, I can take it out without having to go through other brain tissues. But if it is large, then the chances are there will be some complications, or likely complications.
So I think the fear for us is head.
Brain.
Even when you bang your head, it's just so scary that it will involve getting through our skull. Like, if you break our skull, what is left? Then we are gone. So could you maybe describe to the layman how careful and what the procedures are to keep you safe and alive after the surgery?
So the first thing I would say is that technology has gone far, far, far beyond what we used to talk about 10, 20 years ago. The myth out there is that once the head is opened, you're never going to be well. But that is not so anymore. The technology as it is available, even in Nigeria now, would allow brain surgery to be done in many places and to be done safely. So if there's a brain tumor, we want to find out what it is. Some tumors are very close to the surface. You open the skull, you see the tumor, you take it out, then you put the skull back.
The way you do your hand,
Yes,
like you
surgeon.
open.
Neurosurgeon.
So there are some that are deeper down,
Okay.
that you open the brain, you look at where the tumor would be, then you decide the best approach to the brain. Because like I mentioned earlier on, there are so many tracts in the brain, and you don't want to go through the track that will make the patient worse off after the surgery. And this comes with planning. And I would say that in the country now, there are so many neurosurgeons, and they are doing all these procedures safely. And if anybody has that diagnosis, the earlier it is removed, the better.
Okay, I wanted to ask about the possibility of regrowth. after a removal of a tumor, is it possible, or with the brain, does it never grow again? Or is it possible that there's a regrowth, and what happens to that?
So let me classify the brain tumors into two. There is the benign brain tumor, which means if I removed it completely, it is never going to grow back. There is the other half, which unfortunately is about 75%, which is malignant. That whatever the surgeon does, the chances are that the brain tumor will grow back. So usually, after such surgeries, the patient may have to go to the oncologist to give radiation or to give chemotherapy. So for many of these tumors, if it is well removed, completely removed, the chances of coming back is small. But I will also say that, if somebody had cancer of the leg, and you know that it could come back, you can sacrifice the leg. If it happens in other parts of the body, you can sacrifice. But just like you said, for the brain, you can't just cut off the head. So you still have to go in, take out some of it, as much as you can safely, and send for chemo or radiotherapy.
I met someone over the weekend who had cancer, and he was stage 4. And he went back to his village. And they started giving him herbs and different things. And then today, the cancer is not detectable. He's okay, he's living his life as if he never had cancer. So there is that group of people who believe that whatever I have, let me just go to my village. There are herbs that I can take. Now, I know that doctors don't believe in in herbs. You are more, we must use the knife to cut. How can they work together? Because I am one of the people that would rather go for, God forbid, that I have anything like that, but I would rather go the traditional way, the herbal way, before I use a knife to cut. Because I'm also one of those people that believe if you cut this place like this, it can never be the same again. There will always be a scar there,
So I would address that.
Please do.
I believe that out of 2 or 3 witnesses, a matter is established. If you chose to go through the traditional routes, I will advise that you check it out in the orthodox way. So if somebody had brain tumor and decided to go traditional, we have never been able to document such. I would advise that he gets a medical report or do appropriate imaging to be sure that it was brain tumor ab initio.
No, it wasn't. I don't think it was a brain tumor. It was
Okay,
cancer,
it could be any cancer at all. You appreciate there's a lot of money being pumped into cancer research and education worldwide, where they had limitless amount of money to spend. And they have not been able to document that just taking herbs will make it go away. I am not saying it is true or it is not true, but I would advise that we'll have something to document that indeed it is what it was said it was.
So let me take you back into this surgery. And the reason many people are scared, when anything about the brain, we feel like our brain controls our sanity. If anything...
We are our brain.
We are, it's about sanity. And at any point when doing such surgery, is there any concern for how removal of this tumor might affect other areas of life, ability to function well? I think I had a neighbor maybe 7 years ago, an old elderly man who had a brain surgery, and I never knew that could happen. They took out a part of his skull, and they were going to go back for the surgery again. So he was telling us that if you press his head, you could actually press his brain, because they were going to go back to the US and continue that surgery. They just stitched it up. I didn't think that was possible. And we're talking to people that don't understand these things can happen, like they can open up your brain. So in a breakdown, can we go through all these medical processes where they open the brain, come back, body function is still okay, or are there times where you sacrifice a bit of body function so that the person can still remain alive?
So all the options you mentioned are correct. Sometimes you may need to sacrifice a part to take out the brain tumor. yes, it is true that at surgery, the brain is just like a box. You can take part of it off. You can decide to replace it immediately. You can decide to replace it later, because once you take out the tumor, the brain might swell, and you don't want the pressure in the brain, so you can decide to keep it, and when it settles, you can put it back. And yes, there are so many landmines in court on the way to removing brain tumor. And for most brain tumors, the margin of error is so small, sometimes 1 millimeter. And that is why many times when you want to, when neurosurgeons are about to remove brain tumor, they need a microscope that could magnify every tissue 10, 15 times. Then you could see, oh, this is a knife I shouldn't touch. This is a blood vessel I shouldn't cut. So there are so many landmines on the way, and you have to tell the patient, see, all these are possible. But before a neurosurgeon would attempt such, he must have done so many. He would know what lies behind what. He would know the parts in code, in 3D, so that you know where to go, where not to go. Then you could see, then you could be careful. But even at that, sometimes, with our best interest in mind, I mean, with the best interest of the patient in mind, some stuff still do happen, unfortunately.
So someone did a fibroid mammotomy, right, of a fibroid, and somehow the uterus started bleeding. Does this happen in brain surgeries, and do they heal if such a thing happens, or does it affect the entire?
So it does happen, unfortunately, and that is why the surgeon has to be careful. Do they heal? Fortunately, yes. In many instances, the brain is quite unforgiving when you make a mistake, but sometimes you get away with some of them. So it may initially be very poor, but over time, with physiotherapy, with rehabilitation, you would never know there was a problem.
You know, when you're talking about seeing in 3D, it reminded me of Ben Carson's book, Gifted Hands. I don't know, it was just inspiring, a neurosurgeon in America. I'm sure you've heard of him. And in that book, you know, for a young man at the time reading it, it highlighted how careful the neurosurgeon had to be. And here in Nigeria, we have this belief that Nigerians, we're not into the tiny details, we can be careless. And so you find someone who wants to do a surgery of this, you know, magnitude, rather go to the Oyibo man, who is known to be careful, understands tiny details. What sort of surgeons would you say we have in Nigeria? I mean, apart from you, of course, and the success story that we're talking about now, like, what can you say for your colleagues here in Nigeria who are neurosurgeons and doing their job successfully?
Before you answer that question, let me take this call. Mrs. Ojo has called in from Alapere. Welcome to the show. Good morning.
Good morning, ma. Good morning. Thank you. Please, I want to ask you just a question. Because now they said there is no more neurosurgeon in Nigeria. So it's very difficult to get him. So how can we get the doctor now? Because we have so many people at hand now that need neurosurgeon doctor.
Okay, so that's a very valid question. According to what she's saying, she heard that there are no more neurosurgeons in Nigeria. How do you now get a very qualified person? But before you answer that, take Mariam's question.
Well, I think more or less they're similar. I would say clearly that there are neurosurgeons in Nigeria. At the last count, we're probably about 100. And these are 100 people that have been well-trained. None of them spent less than 4 or 5 years, in training to become a neurosurgeon. So yes, there are neurosurgeons. No neurosurgeon will be careless. All neurosurgeons are taught to pay attention to details, because the margin of error is 0 to 1 millimeter. So and the best time to do brain tumor is the very first time. So it has to be right the first time and every time. About the facility, yes, there are facilities to make surgery safe, but not all states of the Federation has enough to do some of this surgery. You realize that there are two different things I'm talking about. The surgeon is well trained, but do we have the facilities?
Yeah.
So some centers have enough facilities. Some they're still struggling, and the attention would be that the government should pay enough attention to such area and make sure the facilities are available.
NEPA can't take light during surgery.
Unfortunately, it shouldn't happen.
Someone like Ruth, that I know NEPA takes lights, what would happen?
No, I don't think that happens anymore. For the past 5 years or so, I'm not quite sure, but about 5 years, we have uninterrupted power supply in Road and in the theatre.
Is that generator or NEPA gongo?
I think the management was good enough to get a power plant that is completely off the grid of the national grid. So there is almost always electricity.
I'm so happy to hear this, because we don't hear this enough. When things shut down, you will hear it all over social media, but this is a good information, and we're happy to hear that, really. You know, I was just checking neurosurgeon, neurologist, and in the wake of Japa and many doctors leaving, this is a bit outside brain tumor, but it's just something that it's been in my head. When I see a very high-ranking doctor, I would ask the doctor that, okay, why are you still here? And what can we do to get more people like you to remain here?
Well, that's a very important question. People are staying for different reasons, and many people are leaving for different reasons. But if we are to build the country, we can't all go. Some would have to stay and do what they have to do to the best of their ability, and also train other people to go. I mean, to practice as much. Because it's so easy for somebody to leave, but it's going to be difficult to live with your father, mother, cousins, brothers, and so. So we have to stay back and build our country. And I think I didn't answer your question about the skills and people going abroad. I want us to be clear that going abroad doesn't mean that you are safe. If I have done 500 cases of a particular tumor, and you're going to somewhere abroad that the person operating you has done only 5, we can't be on the same plane, regardless of what they have. So I don't think everybody should say, look, I must go once there's a brain tumor. It doesn't work that way. And what about the supporting system? What happens when you're there? What happens if there are complications? I think we should build our system. More would stay, some would go, but we don't have any other country. We have to build Nigeria.
As in, honestly, thank you so much for that. There is another, in that same Japa and medical challenges situation, you spoke to the issues with, there's the other half of that question, which is that what can we do as a government, what can we do as a people to make the system work better for, and I know that the issues affect everybody. It's not just medical system that people are living from, but what will be the core of what the doctors are complaining about that is making them go, and what can we do to make them want to come back?
So there are push and pull factor. If there is a neurosurgeon in a particular center without operating theater, without operating microscope, without a supporting system, and I think at this point I must say that neurosurgery is not a one-man show. I need an assistant, I need a qualified anesthetist, I need people in ICU to look after the patient when I'm gone, I need younger colleagues to look after the patient. So there's a lot of things, there's a lot of reasons why somebody may want to go, sometimes far from the money. But to answer the question directly, what can we do? We should encourage those that are behind, number one. Number two, particularly in neurosurgery, state government should make equipment available for safe neurosurgery in each state of the federation. And the federal government, which is what has been happening in other parts of the world, should have a regional neurosurgical center that can do the high-end surgery. So the state or the individual local government could do the bread and butter of neurosurgery, borehole here, repair a few things. The state could do a bit higher, and the national could, I mean, there should be like a national neurosurgical center There is a National Neurosurgery Center in Queens, in London, the Queen's Hospital. So if we could have that maybe in 6 geopolitical zones of the country, you find that there is actually nothing we can do in the country. It may even surprise you that some people would go abroad. It's Nigerian neurosurgeons that would treat them.
Exactly.
Yes. Yes.
Let me take a call. Mrs. Ladiji has called in from Jos. Welcome to the show.
Good morning.
Good morning.
How are you, ladies?
Very well, thank you, ma.
Fine, thank you.
Thank you. And continue to tell your husband I'm grateful for allowing you people to be on this program. God bless them. I want to buttress this neurosurgeon claim. I'm an 11-year colorectal cancer patient. My surgery was carried on by Professor Ismaila in Unijos Teaching Hospital. My children were doing everything possible for them to carry me abroad. I told them no. Whatever they can do in Nigeria, I would rather die in Nigeria than to be carried in a box from another country. And, my surgeon, I was told that I was in the theater for like 6 hours or so. But, the care I got, no matter where they carry me to, I don't think I can ever get that care. We have wonderful surgeons, wonderful doctors in Nigeria. We should please try to encourage them and insist that the government must do the right thing. When they have the right thing to work with, they are better than the abroad one. I'm telling you, honestly speaking.
Thank you so much. It's so interesting.
The vote of confidence
We see
for
videos from India where Nigerians go and
It's terrible.
the aftercare is terrible.
even post surgery, pre-surgery,
Pre-surgery,
pre-care. It's almost, once you are there, you have no protection. So
It's terrible. There's this Adeoye Oladayo, sorry, who has been tubing about his mom who had a stroke. He says, my mom is the person that eats garlic, ginger, in fact, healthy eating and food. Wow, so I wonder where the hemorrhagic stroke came from.
So stroke, there are different types of stroke. There is ischemic one, which literally is a dry one. There's no active bleeding in the brain. It just means that the blood supply to the brain is cut off. There is the active one or the hemorrhagic one. And it has nothing to do with garlic or whatever. It is about lifestyle. If somebody is hypertensive, is prone to developing hemorrhagic stroke. And if it happens, it could be a disaster. Mm-hmm. So all he has to do, apart from eating whatever he likes, is to keep fit and watch his blood pressure. And I must say this, many people don't know about their blood pressure, unfortunately. And there are few people that know that they are hypertensive. And they just ignore it. They say,
And
no,
they think
I don't
garlic
want to treat
and
anything.
ginger would reduce it.
Unfortunately, yes. And I've seen people that would present with hemorrhagic stroke, even though they knew they were hypertensive, but they were never taking antihypertensive medications.
Sir.
So without medications, they can't control the conditions. They must be on
tell.
medication.
So once the blood pressure starts rising, except something brings it down, he keeps going. And that blood pressure that is increasing means there's a lot of pressure within the blood vessel. And it's just like balloon. If you keep blowing it, after some time it will blow. So if the blood pressure keeps going higher and higher, in the brain, the pressure is felt. It's a matter of time it will rupture. And when it ruptures, it is a disaster.
So,
Ibrahim, we have a call.
can you come back?
Yeah, Ibrahim. Ibrahim has called in from Abuja. Welcome to the show.
Yeah,
Mr. Ibrahim.
yeah, good morning.
Good morning.
Yeah. The neurosurgeon said one of the signs of possibility of tumor is constant headache. And most people, when they have this constant headache, it is part of the migraine. Is there any relationship with migraine and tumor in the brain?
I think, well, not particularly, but I would say it this way. Any headache that doesn't go should be investigated. Especially if the headache is worse in the morning and gets better by day. It could be a sign that there is something going on in the brain. Now, when you use the word migraine, for many people on the road, on the street, it means, oh, a headache that is always there. And it could be ordinary headache. It could be headache from tumor. It could be the migraine type headache. It could be so many things. I think what we should go away with is that if the headache is coming and it's not going after 3 days, you should see the doctor. And if it keeps coming back week after week, month after month, you should get the brain scanned. It would be better off to have a negative brain scan, which means that I've done the brain scan, there's nothing there, than not to do the brain scan and 5 years later now realize that the tumor had been there for a long time. I would say that for a particular type of tumor, like meningioma, it takes like 5 years for the tumor to be 1 centimeter. So most times, the tumor had been there years before it is diagnosed. And the person would say or would agree that the headache has been on for 5 years, 10 years, well, just like every other headache. So I think to answer the call, if there's headache that has refused to go, the head should be investigated.
So I would like to ask, there's a tweet here who says, I'm literally taking notes. That's Fashida Favor. I'm inspired by you, sir. I'm an aspiring neurosurgeon currently in med school. Right? And I wanted to even ask what you think about our education here in Nigeria, especially medical school. We have a lot of people that are working hard to be able to go abroad to school. Is it better there, or our medical schools doing a good job here, and we're sure to have even more neurosurgeons from our medical schools here in Nigeria?
I think our medical school is fantastic. I trained here, University of Lagos College of Medicine, and I know many other neurosurgeons in Nigeria that are trained locally. I also know many other neurosurgeons in US, in England, in the Middle East that are trained locally. The current president of the World Federation of Neurosurgical Society, the #1 neurosurgeon in the world, trained in Nigeria.
Wow.
His medical school in Nigeria. So the guy or the lady that is planning to be a neurosurgeon, I will encourage him or her to keep at it. It is possible. Our medical doctors are not inferior to any doctor anywhere in the world.
Thank you, sir.
It's just tools that they don't have.
Our neurosurgeons are equally fantastic. In fact, the type of tumor that some of us take out in Nigeria, they'll probably not see it in US because it's always large, it's quite complex, and they see it very, very early and they quickly take it out. We see it when
at
it is
advanced
large.
stage.
So our education is good.
Honestly, we're out.
Are we out of time?
Yes.
No way.
Have you not seen the time?
If you trained here, but you went abroad and came back?
Yes. So I did my medical school here. I started my residency here in University of Lagos College of Medicine. I did fellowship in Australia. I did 2 years in England. I did fellowship in Germany and US. I went around a little bit.
Interesting.
Came back.
Came back, all right.
Thank you for coming back.
Honestly, you came to educate us about brain tumor, but you've left us inspired. You know, you've renewed our hope in the medical system in Nigeria. And I'm sure many people watching right now would be more excited about going to visit the hospitals. And those who want surgery will not be scared that things might go wrong. And I think we need more messages like this being pushed to Nigeria in this season.
Please come back on the show.
Yeah,
Yes,
please.
we need to talk
Thank
more.
you so much.
Thank you very
That's
much.
all we can take on the show today. I'm sure you learned something. We'll be seeing you tomorrow. Bye.
Thank you.